Hey guys, my name's Tony Maritato. I'm a licensed physical therapist, and in today's video, I want to talk about the three most common scenarios I see when therapists want to become contracted Medicare providers. Now, I'm speaking specifically about Medicare Part B, and I'm speaking specifically about physical and occupational therapists who want to be contracted as private practice owners or speech language pathologists. So this is the most common cases that I see. So number one, it's the individual who's a sole owner of their business. There are no partners, no other business entities that are involved. It's just you're a single therapist, you're the only owner of your PC, LLC, PLLC, and you're submitting your first-time Medicare contract. So you will need a Medicare Identity and Access website login. You'll need a login to the NPPES, which is the MPI registry, and you'll need a login to PCOS. So I'll supply links for all of those websites, but that's kind of the prerequisite. And then a couple of the things that need to happen next is you're going to need your personal MPI. That's also called a Type 1 MPI. You're going to need a Type 2 MPI, which is an organizational MPI for your business. You're going to need to have yourself listed as the authorized official for your business in the Medicare INA system. Now, that's not actually a requirement, but it's going to help you in the future as you grow your business. And then, of course, what we need to do is you're going to submit a single application through PCOS. If you've heard letters and numbers for applications, you've probably heard the 855I, the 855R, the 855B. But if you're a sole owner, everything is done in one single PCOS application. So it's a pretty simple process. I have a video course that walks you through each screen in the PCOS enrollment. My main goal today is just to kind of give you an overview. So scenario number two is you are a co-owner of a business. Now, it could be one partner, it could be multiple, but the idea is that there is more than a single owner for the business entity. In a case like that, what's going to happen is, again, you're going to have to have your personal MPI. You're going to have to submit for an organizational MPI. Of course, you're going to have your personal Medicare Identity and Access website login, your MPPES login, your PCOS login. You're going to indicate that you are the authorized official for your business within your Medicare INA system. In this scenario, you will have to do that before you can submit your PCOS application. And then in PCOS, you're going to submit two applications. It doesn't matter which one you do first. You can do the 855B or the 855I, but effectively, when you log into PCOS, you're going to submit a personal application to get you a personal Medicare provider number. And then you're going to submit an application for the business. And it will give you a Medicare PTAN, Medicare provider number for the business. And at some point in that process, you're going to submit the 855R, which is the reassignment. It can be done from either application. So I would tell you whichever application you submit second, that's the one you're going to submit with the reassignment information. But then what you'll have to do is any other practicing therapists that are co-owners of the business, you or they will have to also submit an individual application with the reassignment to connect them to your business. Any non-therapists that are co-owners, they won't have an individual application, but they will be listed in the application on the business as 5% owner or more. So you will need their information. The third scenario is you're already a business owner, you already have your private practice contracted with Medicare, and now you're hiring a therapist. You're either going to hire a W-2 employee or you're going to work with an independent contractor. In both cases, you're going to have to reassign benefits for that individual. And that individual is basically either going to have a Medicare PTAN already or they're not. They may already have a personal MPI or not. In this scenario, if they don't have a personal MPI, maybe they're a new grad or they've worked for a hospital their whole career, you'll have to connect with them through your Medicare Identity and Access login. You're going to send them a request. They're going to have access to their own personal Medicare Identity and Access account. They should have access to their own MPPES account so they can apply for their own MPI. They're going to grant you permission to access their PCOS account. You should never ever request their username and login information. You should never request password information. You only connect to their enrollments through your Medicare INA. Once they approve you, once they grant you access, you are going to submit a reassignment. Now, there's a couple different ways to do this. So if the therapist has never been issued a Medicare provider number in your state or territory, you're going to submit the complete enrollment. You're going to submit the 855I. They're going to be listed as a group member only. If you get into the application, you'll see what I'm talking about. And you'll submit the reassignment information on their behalf. If they already have a Medicare provider number in your state or territory, you can simply do the reassignment of that number. It's not the entire application. It's a much, much shorter process. There's a couple different ways to do it, either from within their PCOS account or from your account as a business owner. In either scenario, again, we have videos kind of walking you through that entire process. But I just wanted to make you aware of kind of the three most common scenarios I see when therapists are trying to contract with Medicare. If you have specific questions, if you have a unique circumstance to your case, go ahead and let me know in the comments down below. Otherwise, I wish you the best. The more therapists we have working in private practice, the more powerful the profession becomes, and we gain credibility and exposure across all of healthcare. All right, guys, thanks so much for watching. I'll catch you next time.